Do you see slides, Michelle?
No. I was gonna... Should I be sharing them? Barry, do you have the slides?
Yeah, do you want me to share?
Yeah, that'd be great.
Mm-hmm.
Thanks, Barry.
And then you'll just tell me when you, I'm sure it'll be pretty obvious, but you could just tell me
Yeah.
when you want me to go to the next one.
Totally.
Perfect.
Oh, great. Thanks, Barry.
Mm-hmm.
So we'll just give people a few more minutes. Barry, if you could just let us know when people are like stopping joining, or you see like a...
Let me see how many.
It looks like people are still coming on.
Right, yeah, so. So for those on the line, we're going to just wait another like 2 minutes to give everybody a chance to join, and then we'll begin. Okay, so I think we're going to get started, and then hopefully if more people join, they can just kind of join at whatever point they're able to get on. We are going to be putting the slides up on our website. On the last slide, we have people to contact if you have any questions or comments about today's presentation. So thank you for joining us on the Seaver Center's second Zoom call. Today, we're going to focus on caregiver self-care during this time, which we felt was an important topic, and also something that a few audience participants last week said that they would want to learn about. Unfortunately, Dr. Trellis is not able to join us, but I am here. My name is Michelle Gorenstein. I am a clinical psychologist and director of outreach for the Seaver Autism Center. I'm joined along with Dr. Jessica Zweifach.
Hi, I'm also a clinical psychologist here at the Seaver Autism Center.
So for those that were with us last week, we're going to do a similar kind of session. We're going to kind of do 20 minutes of talking and leave a lot of time for questions and answers. And I want to apologize for those that were with us last week because we did get cut off abruptly. We have solved that problem, so that will not be happening again. So we will leave plenty of time to answer any questions that you have. We also want to hear about ideas for future webinars that you would find helpful. So with that being said, so today we just gave our brief introductions. We are going to talk about parent self-care, kind of the basics that often us parents forget about during kind of challenging times. We are then going to talk about cognitive strategies that parents can be using at home while they manage stress of being a homeschool teacher, managing the household, potentially working, and all that comes along with it. And then lastly, Dr. Zweifach will talk about behavioral strategies that parents can be using at the home to kind of manage their own stress during this challenging time. So why are we focusing on this? I think all of us as parents, the first few weeks, we're focusing on getting our families, our children, up and running with their new routines, managing their anxiety, their stress, their emotion dysregulation. But we often forget about ourselves. And what we do know is parent stress can kind of feed into the family stress. So when parents are calm and feeling okay, that kind of sets the tone for the household. So it is really important to focus on your own well-being. While it's challenging to do that and to find the time, it is critical that we do take care of ourselves. So I also like to think about the analogy of being on a plane, and when they say to put your mask on before the mask of somebody else, it is really, really important during this time period to focus on our self-care and to not feel like we're being selfish if we need to take 20 minutes or 30 minutes out of the day to do something that makes us happy, because doing that is going to make us a better parent during this challenging time. So when we think about the basics, we often forget some of these things. So it is really important that we take care of our physical health. So that means making sure we are eating. So while we are getting our kids' meals prepared and preparing family meals, make sure that you are also getting the nutrition that you need. And that might mean stocking up on dried fruit or nuts or things that are non-perishable to have in the household for you to snack on during the day. But it is really important that you are getting the nutrients, because that's what's going to give you the energy to get through these days. It is, I know it's kind of ironic that we say this, but it is really important that you get the sleep that you need. Often finding the time to get the amount of sleep right now is probably challenging, but when we are better rested, we are better able to manage stress, we are better able to manage anxiety, and we're going to be a better parent if we are rested. So the last few pages do have some resources on sleep hygiene, or for individuals that are experiencing insomnia or significant anxiety that's interfering with the sleep. There are also resources to help you with that. It is important that we try to get some exercise, whether that's if we're in an area where we can go outside for a walk and maintain kind of our social distancing, that's great. There are lots of apps and websites that are putting free content. It could be something that you do as a family. If you do want to get into the habit of doing yoga or doing a quick exercise, incorporating your kids into that time could be an opportunity for you to get some movement and exercise and keep yourself healthy. It is also important that you kind of maintain your own medical health. So if you do have an underlying medical condition, make sure that you are in contact with your doctor, you have enough of your medication refills, because again, as parents, we often focus on the needs of our kids, but it is also important that we focus on our own needs. And what we're going to spend most of the time today is talking about our emotional health. So we are going to talk about ways to stay connected, how to connect with your spirituality, and find internal space for yourself. So as a CBT therapist, I often think a lot about cognitive strategies. And what this means is we all have tons of thoughts running through our head at any point in time. And some of those thoughts are productive and help us move forward with our day and feel good about the day. And then we have a lot of negative thoughts. And often families right now, while we're undergoing all this stress, have a lot of negative thoughts running through our head. And kind of being able to change how we view things is going to change how we respond, change our mood. So I'm going to kind of go through some of the basics of cognitive strategies that as parents we can be using to help us feel better, reduce our anxiety, and manage our emotions. So the first thing is validating and labeling your own emotions. So if you are feeling overwhelmed, if you are stressed, if you are frustrated, know that those are totally acceptable, normal, rational responses to kind of the situation that we were all put in, and giving us permission to feel that way. So I'm feeling overwhelmed right now, and that is okay. I'm dealing with a lot. And giving ourselves space to feel that is also important. It's also important that as parents and caregivers, we're shifting our expectations. It is not expected that you are now your child's ABA therapist or their special educator. It is not expected that you are their child's speech therapist, occupational therapist, physical therapist, that you're also potentially doing your job, working 40 hours from home. that your household is going to kind of maintain the same cleanliness or order that it did before. So kind of really thinking about what things is it okay to let go of? Is it okay to not have your house as spotless as it was? Is it okay that your children might stay in pajamas or get a little extra screen time so that you can kind of take care of some work? Absolutely. So kind of thinking about what are your roles that need to get done every day, and what things is it okay to kind of push to tomorrow, or say, you know what, in the grand scheme of things, that is not that important. It's also important to, we're trying to teach our kids to be flexible. It's also important that we're flexible. So something that I've been practicing a lot myself with is, if a morning or afternoon is not going well with schoolwork or something else that I had planned, saying, okay, let's go for a walk, or let's have a dance break, or let's do 30 minutes of screen time and kind of all take a breather and then regroup. And giving yourself permission to kind of modify schedules as needed. Also, if a schedule is not working for whatever reason, it's okay to change it and modify it. Don't feel like something is stuck and that you have to be fixed on that. If something is not working, you have the capacity to change it. It's also important that we reframe situations. So as parents and caregivers, we are also human. We are also managing a lot of our own emotions. I know, for one, I've definitely raised my voice at my children due to my own frustrations about the situation. And rather than kind of get into a cycle of blaming ourselves or feeling bad about what we did as a parent, reframing the situation and saying, okay, you know, I lost my cool and I didn't regulate my emotions so well. And I'm going to use this as a teaching lesson for my child and show them that we all make mistakes. And I'm going to apologize. I'm going to say the mistake I made. And I'm also going to show them the strategies that I used to calm myself down. And I think it's important to recognize as parents, those are really important moments to show your child, because we are not perfect. We're not expecting our children to be perfect. So we shouldn't expect that from ourselves, and being able to teach from those moments is going to be really impactful. Also, be kind to yourself. When you start feeling like you're in this cycle of kind of self-blame or kind of feeling down about yourself as a caregiver or worker or daughter or wife, think about, what would you tell your closest friend if they were in that specific situation? Because often we give really good advice to those around us and we're really hard on ourselves. So kind of asking yourself that and giving that same advice to yourself. Also, notice the unhelpful thoughts that you keep having and challenge them. So if you have a thought like, I should be able to get through all of these assignments my child's teacher is giving us, I don't know what's wrong with me. Reframing it and saying, I'm doing the best that I can to help my child complete these assignments while I'm managing all these other responsibilities. There are going to be other days to catch up. And if this work is not reasonable, I'm going to reach out to my child's teacher for suggestions. The Seaver Center is there as a support for you. Your child's teacher is there as a support. Their therapists are there. And use us as kind of resources to help you manage. Also utilize self-talk to help you through the stressful situations. Remember that while it might feel like this is a never-ending pandemic, we know that there is an end in sight and that things will return back to a new normal. Children will go back to school. Children will receive therapies. So just reminding ourselves that we have to get through this for probably a little bit longer, but that there is an end in sight. So I'm going to turn it over to Dr. Zweifach, who's going to talk to us about behavioral strategies to help us manage.
Hi, everyone. So thanks for making the time and joining us today. This is a great part of your own self-care if you're here as a parent or just to gain knowledge and hopefully talk together at the end if you're a provider. So I'm going to be talking about the B in CBT. So Dr. Gorenstein was talking about some ways that we can change cognitions and control our thoughts and think about how to reframe in order to improve our mood and emotion. And I'll be talking about some behavioral strategies to hopefully do the same. So I'm going to go very briefly through a whole bunch of strategies. So this isn't meant to be a time to master any one of these strategies, but just an overview, some things to think about. The slides will be made available, so if there are any that you want to reach out to us about specifically for tips, please feel free to email us, or you can read more about some of them online, because these are all strategies that we use in our personal lives and also use with our therapy patients, both adults and children, all the time. So we're happy to talk in more detail about them after this introduction. So to start out, just behavioral activation, which is kind of the first line of treatment for most CBT therapies, certainly for depression. So a way to do that is to just at least plan during this challenging time that we're all going through one pleasurable activity every day. It can be something that's 5 minutes long, but we just want to make sure that you have something that is just for you, not for your kids, not for your work, not for your partner, just listening to a song, taking a bath, engaging in some hobby that you might have. Just some alone time where you feel like you know that no matter what else happens during the day, you've engaged in that reinforcing and pleasurable activity. Another example, and some of these could be other, could become pleasurable activities, would be an affirmation. So we suggest posting a phrase that's really motivating to you. It could be, "Today is a new day. I'm strong and capable." It could be a quote. It doesn't have to be something that is unique to each day. Possibly putting it on a post-it on your mirror in your bathroom so that you know that anytime you go in there, you'll just take a moment, breathe, and read that positive statement to yourself. So another way to improve your mood there. In addition to sort of the opposite of behavioral activation, we suggest cutting one activity that you just wouldn't miss, that your family wouldn't notice if you didn't do. This is part of being kind to yourself, like Michelle was speaking about before, that we want to be flexible with ourselves. If we're at home doing all the housework, all the cooking, and we're the teacher and we're doing work, it's not possible to get it all done. So be kind to yourself and cut something at least every day or every week that you feel wouldn't be missed in your home. In order for you to be able to take care of yourself, we want to be fostering our children's independence a little bit. This speaks somewhat to what we were talking about in the last webinar. For those who weren't able to attend, we're going to have that posted, where we talked about visual schedules and organizing time. We want to support our children's independence in their play and in their activities a little bit so that we can go and have alone time or time to care for ourselves. So one way to do that would be to put in about 5 minutes of play or special time with your child. Let them know that at the end of 5 minutes, you're going to be transitioning away. Most of the time, kids will be fine with that. You've sort of set up the activity, they're engaged, and then you give them a little bit of space and you foster that independence, which is a great skill anyway. Also, being flexible with ourselves. The screen time rules that we probably all had before this time at home together are different and should be different. So allow for it, be more flexible, allow for more TV time if you need to that day so that you can take a walk or listen to a song or whatever it is that you need. We also would recommend scheduling some time for a social outlet with other adults, whether it's a phone call, FaceTime, something on Zoom like this, where you just have an outlet and aren't necessarily talking or thinking about kids or certainly online learning or things that you're struggling with, but just have some time that's all about you. It's great to schedule one of these early in the week or early in the day so that you kind of have to stick to it and stick to that plan. Because if we're really feeling down, there are times that we don't want to engage in that behavior, but know that if we do follow through with it, our mood can really improve just through sticking to it and knowing that we put that time in. So social outlets are an important one. I'll go through a few more now. Am I able to advance the slide, Barry, or maybe not? Thank you so much. Another thing to think about, and this is personal for each individual and each parent, but consider limiting the content, limiting what articles we're reading about COVID. It's all around us. Of course, there are important things to be thinking about, important articles to be reading. We're thinking about our health and our children and families' health all the time, but possibly limiting how often you're reading articles if you're finding that after reading the articles, your anxiety increases. Some other behavioral strategies to consider would be meditation, deep breathing, and imagery. All of these, on the last few slides, we have specific resources with links where you can download meditation apps, guided breathing, and even some guided imagery. The imagery, can be as simple as just closing your eyes and going to a happy place for you in your mind, or it can be going through a more detailed script, which you might need an app for, or might have worked with a CBT therapist on before, and you can sort of pull that out and think about it again. The Mandala adult coloring books and coloring activities, there are tons of free pages online. That can be a great, really soothing activity for certain people. Maybe while your child is doing some kind of handwriting work or other art, you could sit together but do something that's soothing to you as well. Progressive muscle relaxation is something that people spend lots of time, with a therapist learning how to do in CBT. The basic idea is to tense and release all the muscles throughout your body. So possibly starting with your feet and working up to your head to sort of tense and release. There are definitely instructions online if people have more questions about that. It can be a great way to just release some of the tension and tenseness in our bodies, and it certainly connects to our brains and can bring that whole level of anxiety down a little bit. It's a great one because you could take 2 minutes to yourself, relax your body, come back out of your room and feel ready to rejoin whatever your children need at that point. Other kinds of physical activities. It doesn't have to be progressive muscle relaxation specifically, but as Dr. Gorenstein was talking about before, taking a walk, stretching, or a yoga video, other ways that our body and mind are absolutely connected. So if we can calm our bodies down, we expect that our mood and our emotions will feel taken care of as well. Another great tip that a lot of parents are using now is to do sort of a gratitude jar or a gratitude conversation with your family at the end of the day, so that no matter how bad a day is, and it's okay if the whole family feels like today was a wash, tomorrow's a new day, there's usually something to be thankful for. So helping ourselves foster that sense of gratefulness and work with our partner and our children or whoever else is in the home with you to think about whether you can come up together with a list of things that you feel good about at the end of the day. Of course, seeking outside support, either through peers or other family members or therapy if needed. It's hard, of course, to get started with a new therapist during this time because it isn't face-to-face, but most providers are doing telehealth right now. If anyone needs referrals, we're here. You can absolutely reach out to us and we can find them for you. So it is possible to get that help even if it isn't in the traditional way that we're used to in an office setting. And it's important to consider whether you might feel like you're needing that. So those are the behavioral strategies, and I think we're ready to do questions and answers. There at the end part of the slides will be a whole bunch of resources for all the different kinds of strategies we mentioned, cognitive and behavioral. And we would love to hear any of your questions. For those who were here last week, if there's anything we didn't get to, please write into the chat and let us know. We were happy to talk about questions from last time about structuring your day. And thanks so much for your attention. So we're happy to open up the chat now if people had questions.
And also you could use the chat if you have topics that you would like to address for upcoming webinars. And there's also the email addresses of our 2 coordinators who will be managing our webinars and kind of contact. I'm gonna slide forward to just show you the resources quickly and how we organize that. So there's general mental health resources. There's one specific to New York City where, as Jesse mentioned, or Dr. Zweifach mentioned, if you are feeling particularly overwhelmed and want to speak with a professional, they are offering free mental health support. There are other more national websites that are offering support and resources at the time to manage anxiety and just overall mental health. Here are some, here's a good resource from the Sleep Foundation on sleep guidelines during the COVID-19 pandemic. I included 2 articles that list tons of free websites, free apps, other modes of social media that are offering at-home exercise routines, whether it's from yoga, Zumba, more relaxation exercises, but I've included those as well. As Dr. Zweifach mentioned, there are a lot of apps and websites offering free content with regards to meditations, guided imagery. So Headspace is currently offering free exercises. The Insight Timer has a library of over 30,000 meditation exercises. UCLA Mindful app, which is always free. And Calm has cultivated a series of free relaxation tools called Take a Deep Breath to help individuals during COVID-19 pandemic. So we hope that you find those resources helpful. Feel free to use the chat feature of Zoom if you have any questions for us. So at this point, we want to open up the conversation to specific questions, whether it's related to what we talked about today, or if there are any other questions that you think myself or Dr. Zweifach could be helpful to answer. Okay, so someone just asked if we have any of this information available in Spanish. Unfortunately, we do not at this time. We could definitely look into creating a handout that could be translated into Spanish. And if you reach out to either Barry or Audrey, I could definitely give you other resources that are in Spanish. So Synergia is an organization located at NYC that specializes in working with Spanish-speaking families, and I know they do have a bunch of resources available for parents. Okay, and someone just wrote UMNSU card in Florida has resources in Spanish, and the Autism Society of America. And I also believe some of the mental health resources on that resource page do have things translated in Spanish.
Right. I would imagine NYC Well should have
Yes.
a lot in Spanish, that website.
Any other questions, comments about future webinar topics that would be helpful? Okay. Well, if no one has any more questions or comments, we can end here just because I know everybody is super busy. So I want to be mindful of everybody's time. We thank you for joining us. Again, the PowerPoint will be on our website, and we are going to be looking to potentially get the recording on our website as well. If you have any questions or concerns or comments, you can reach out to Barry or Audrey directly, and they will be able to answer any questions.
Thank you all for your time.
Thank you.
Thank you.